Welcome to the Behery Practice Joint Replacement Education presentation. Viewing this course will help answer many of the questions you may have leading up to your surgery. We would like to let you know that you'll be receiving some automated text messages pre- and post-operatively. These are intended to give you helpful tips, tricks, education, reminders, and assurances along the way. Please note they are automated messages from an AI bot. Anything that cannot be answered from this text messaging, we'll instruct you to reach out to the office directly, and you can always reach us at 630-339-2230. As you can see here, listed on the slide is the program content. This course will cover the important aspects around your joint replacement surgery to help guide you through a smooth experience and hopefully address as many of your questions as possible. If you are having your hip replaced for the first time, your hip may be similar to the photo on the left. You can see there is cartilage loss, bone spurs, and the joint is clearly affected by arthritis. The photo on the right demonstrates what the replaced hip will probably look like after surgery. The worn-out hip joint surfaces will be removed and then replaced with metal components, often made out of titanium, and the articulating surfaces with a ceramic and a high-grade plastic insert in most cases. This is done for the best long-term durability possible. Similarly, this is a demonstration for those having their knee replacement for the first time. On the left is a typical image showing bad arthritis, and the right image showing the knee after removal of all of the arthritic surfaces and replacing them with metal implants and a high-grade plastic insert. This usually lasts over 20 years without significant wear. Scheduling a medical exam, blood draw, and testing within 30 days of surgery is required to ensure your safety to undergo surgery. You should have received instructions from our team as to where to complete this evaluation. Usually, this is done through one of our preferred preoperative clinics, or if needed, your primary care provider. On occasion, we may ask you to obtain an additional evaluation from a specialist, for example, a cardiologist. This is depending on your history. We will specifically inform you if any additional specialist clearance is needed, and those can be completed within 3 months from your date of surgery. We appreciate your attention to the following recommendations to minimize any risk of infection after surgery. Research does show that most surgical site infections are actually caused by the patient's own bacteria on his or her skin. So you play an important role in reducing the chance of surgical infections by these listed methods of skin and nasal preparation prior to surgery. These are achieved with the use of nasal mupirocin ointment and Hibiclens liquid soap. We will go over specific instructions on the following slides. Additionally, stopping tobacco use in any form, ideally at least 6 weeks before surgery, is strongly advised. This will help minimize the risk of infection and tissue healing complications. Also, avoiding other invasive medical, surgical, dental procedures close to your surgery date is important. Ideally, please complete any routine procedures at least 6 weeks before. With any questions or issues with this timeline, please do reach out to our office to discuss. We do make some exceptions depending on the nature of the procedure needed within this period, and we'll gladly discuss your circumstances. Diabetic patients are also at risk for infection and poor tissue healing. In order to avoid these complications, we require our patients to maintain a good blood sugar control and a hemoglobin A1C blood test result of 7.8 or lower, depending on other potential risk factors for infection. Seven to 10 days prior to your surgery date, you will receive a prescription in your pharmacy. This will be for nasal mupirocin ointment, among other medications prescribed for use after surgery. This ointment is used to decolonize the nose. That means remove any potential nasal MRSA bacterial colonization that can be present. Use a pea-sized amount of the ointment inside each nostril each time you apply the ointment. Tilt your head back and use a cotton swab to apply the ointment to the inside of each nostril. Press your nostrils together and massage for about a minute. Repeat these steps 2 times every day for 5 days leading up to surgery. There is evidence that suggests this simple practice may be worth doing routinely to minimize risk of MRSA infection following surgery. Hibiclens liquid soap is also prescribed with your other medications sent to your pharmacy 7 to 10 days prior to surgery. However, your pharmacy may direct you to buy it over the counter as it does not require prescription. We recommend the following instructions of use before surgery. Start 3 days before surgery. First, wash your body and hair with regular soap and shampoo. Next, turn the water off so the Hibiclens liquid is not removed immediately after applying. Using a clean washcloth, apply the Hibiclens to all areas from the neck down except for the genital area. Expect that the soap will not lather too much. Once your body is covered, allow the Hibiclens soap to sit on the skin for 3 minutes before rinsing thoroughly with regular water. Do not wash with any other soap or cleanser after this step. And do not apply any lotions or creams after these showers. Repeat this process for 3 days before surgery. Perform the last Hibiclens wash the morning of surgery as well. Immunizations are often recommended to maintain healthy immune systems. If any vaccinations are needed before surgery, it is ideal to deal with them at least 2 weeks before to ensure you do not feel sick or have a compromised immune system for the day of surgery. Various medications must be stopped before surgery. As a general guideline, please discontinue all over-the-counter vitamins, supplements, and anti-inflammatory medications 7 days prior to surgery. Stopping blood thinners of any kind, including aspirin and the others listed below in a timely manner, is important. Please consult with your prescribing physician of any blood thinner that you take regularly on the appropriate timing to stop. The instructions for this can vary slightly depending on the medication and also depending on your past medical history. You can also discuss this with us as well to confirm if you have any questions. For pain control during this week leading up to surgery, Tylenol is allowed and preferred. Tramadol and other opioids should be avoided if possible to minimize tolerance and potential for difficulty achieving pain control after surgery. For medications prescribed by a specialist, please reach out to them for directions. Failure to stop certain medications in time can put you at risk of surgery cancellation. Importantly, if you are currently taking an injectable medication for weight loss or diabetes management, typically one of the medications listed on this slide, they must be stopped for 14 days prior to surgery. Failure to do so may result in surgery cancellation due to anesthesia concerns. Getting prepared at home will make recovery easier. In the infrequent event that you have issues with your surgical site or dressing, contact us. And if we recommend a simple dressing change, it is recommended to have these dressing items at home just in case. They are available at any pharmacy over the counter and can also be ordered online before surgery in case needed. Examples of what may come in handy are listed below on the slide. Having the proper medical equipment is beneficial for safe recovery. All patients should obtain a standard walker. If needed, we can provide you with a prescription and directions on where you may obtain this. If you have not gotten a walker before surgery, depending on your surgical facility, you may also be provided with a walker upon discharge after. A straight cane is also recommended as you continue to progress with ambulation, walking, once you are home. It will also help navigate stair climbing early after surgery. A shower bench or chair, though optional, may be helpful to facilitate showering early on. A raised toilet seat, not required, but may also be useful after surgery for better comfort while using the toilet independently. If you need orders for any of these items, please call our office. We would be happy to provide them to you. Adequate nutrition is important for tissue healing and recovery following surgery. Your diet should prioritize a high protein intake before and after surgery. You may wish to consider a nutrition supplementation program, and for our patients, we recommend En route. This is a 4-week nutrition supplementation program that includes a high protein content and is specifically designed for patients undergoing an orthopedic surgery. It has goals of enhanced tissue healing and quicker functional recovery. Visit getenroute.com to order or to get more information. You may ultimately decide to manage your nutrition on your own. We recommend a daily nutritional plan that includes meals with a high protein content. In the days before surgery, be available to answer your phone as you may receive calls from the surgical facility or our team for time-sensitive updates or instructions. On the day prior to surgery, you will receive a call informing you what time surgery is scheduled and what time to arrive to the facility. Typically, they ask you to arrive 2 hours prior to surgery for pre-op. They will also likely remind you at this time to avoid eating or drinking anything after midnight the night before surgery. This does include gum, candy, and lozenges. If specifically instructed, certain medications on the morning of surgery are okay to take with a small sip of water. You should bring your home medication list, ID card, insurance card, phone and phone charger. You should also bring items like a CPAP mask and tubing, glasses, dentures, and hearing aids if applicable. If you already own a walker, have it in the car for the ride home, but you do not need to bring it into the facility as they will have one for you to use on site. Do not bring any personal items of value. Remove all jewelry, including bracelets, rings, and piercings to avoid any issues on the day of surgery. You should wear something loose and comfortable, as well as closed-toed shoes that minimize slipping or tripping while walking and going through your first physical therapy evaluation. Upon arrival to the surgical facility at your scheduled time, please check in as instructed. The surgical nursing team will review your history, help you change into a surgical gown, place an IV, and administer medications ordered to help prepare for surgery. Dr. Behery and your anesthesiologist will see you prior to the beginning of your surgery. They will answer any final questions that you may have. The anesthesiologist will discuss the plan with you prior to surgery. The preferred method of anesthesia used is often spinal block with sedation. That means you'll get a spinal injection in your lower back and get an IV medication that puts you to sleep. This means that you will not need a breathing tube, but it still allows you to be comfortable and not feel anything during the surgery. It will also minimize side effects and pain afterwards. After the discussion that you have with the anesthesiologist, if a spinal block and sedation is not right for you, the alternative option is usually general anesthesia, which is still considered safe and reasonable. The best plan for you will be determined based on the discussion that you have with the anesthesiologist prior to surgery. After surgery, you will be taken to the recovery room. This is where they will monitor your vital signs closely as your anesthesia wears off. Your family will be notified that you are out of surgery. And just so you know, most patients spend about 1 to 1.5 hours in recovery before transfer to the next phase. The nursing staff will continue to monitor your vitals and help manage any symptoms. They will instruct you on how to use an incentive spirometer to prevent respiratory complications from surgery. Those of you that go home on the same day of surgery will see a physical therapist prior to discharge. You are given time for the anesthesia to wear off and to become comfortable before participation and evaluation by the physical therapy team takes place. They will train you on how to walk safely and navigate stairs to ensure a safe return home. Those of you who are staying overnight will still be evaluated by a physical therapist. Next stop for you, though, after recovery will be your room. You'll get there, get settled, and then physical therapy will be by to evaluate you. You will have an IV to deliver fluids and medications. Though you'll be able to eat after surgery, it is recommended to start off slow to avoid upset stomach. Pain after joint replacement surgery is expected and varies between patients. We use a multimodal pain control approach with both opioids and non-opioid pain medications to keep you comfortable. It is recommended to take your non-opioids as your baseline of defense, then utilize the opioids for stronger breakthrough pain. Time the stronger pain medication about an hour before harder times of the day, such as physical therapy. A good pain goal to have is 4 out of 10. This chart below is an example of what you will receive in your discharge paperwork. Within it, it will list everything we prescribed, what it is, and how to take it. Within this example is a very common combination of medications that we send our patients to manage pain and to prevent side effects. To note, we send all of these medications 7 to 10 days prior to surgery so you can be prepared. On the left-hand side, you will see Tylenol, meloxicam, and gabapentin. These three are the non-opioids to be taken as your baseline of defense. For breakthrough pain, most patients have two options, tramadol and oxycodone. Tramadol is best suited for moderate breakthrough pain, whereas oxycodone is best for severe breakthrough pain. On the right-hand side, you will see other medications. Baby aspirin, aka aspirin 81 milligram tablets, is given for blood clot prevention. Antibiotics are given at the discretion of Dr. Behery. This is usually cefadroxil for 3 to 7 days. A stool softener, an anti-nausea medication, and an antacid are given to prevent side effects. All of these tools at your disposal are thoughtfully given to you to give you the most comfortable recovery possible. Pain medications, especially opioids, are often needed early on and may have side effects. Common side effects of opioids include constipation, nausea, itchiness, and fatigue. Constipation is one of the most common medication issues post-op. It is important to take the stool softener provided, eat fiber-rich foods, drink plenty of water, and walk frequently to negate this. Beyond pain medication, there are a few things you should be doing to help alleviate your pain. Icing, or cold therapy, is greatly beneficial for post-op pain and inflammation. Dr. Behery recommends considering one of several options available, including ice machines, which are clinically proven to alleviate pain and swelling. There are other options available and likely shared with you in our handouts, and we can review them if needed. Cold therapy should be applied for about 45 minutes on and 1 to 2 hours off as often as possible during the day while you are awake. Consistency with cold therapy for the first few weeks post-op will make recovery easier, and having a reliable cold therapy or icing option is easily worth the investment. Elevating your leg frequently above the heart level is also important to minimize swelling. Dr. Behery advises to heavily consider purchasing one of the available cold therapy machines. For the hip or the knee, they are the most effective in reducing post-op pain and swelling, making your recovery easier and the need for opioids less. We recommend that you use these devices regularly for the first few weeks after surgery. You should aim to use it for 45 minutes on, and you can take 1 to 2 hours off and do it again. While doing so, elevating the extremities will help reduce swelling and discomfort even further. Our DME store, which also stands for Durable Medical Equipment Store, carries a couple options that will be listed in the following slides. We would be happy to provide a prescription upon request. Below you see 2 cold therapy options for knee replacement. Both are available for purchase through the DME store. Give them a call to go over pricing and specific details. Similarly, below you see 2 cold therapy options for hip replacements. Both are available for purchase through the DME store. Give them a call to go over pricing and specific details. Provided below is the contact information for all of our DME stores. We would like to emphasize the impact these devices have. They are truly useful options to significantly reduce pain and swelling postoperatively. Please reach out to our office via phone call or email if you are interested. Preventing blood clots after this type of surgery is very important. Taking your blood thinner, walking frequently, and wearing compression stockings are all things to minimize risk. Your surgical facility usually provides 1 pair of compression stockings, but it is recommended to purchase 1 to 2 pairs before surgery, as you will plan to wear them daily for 3 weeks after. The compression stockings should be removed before sleep and for hygiene purposes. We recommend thigh-high stockings for knee replacement surgery and knee-high stockings for hip replacement surgery. Things to expect in the healing process and to be mentally prepared for include swelling to the knee or hip and throughout the whole leg all the way down to the foot. This is common and may last for 3 to 6 months. You may notice weight gain due to the severe swelling. Blisters may occur from this impressive swelling. This is a relatively common issue and should be covered with the Telfa pads and paper tape until crusted over. Feel free to give us a call if you need help. You may experience a low-grade temperature in the first few days. This is usually considered normal and part of the healing process. But if you develop fevers over 100.4 degrees Fahrenheit on more than one occasion, please contact us to discuss. This first week is usually the hardest, and the overall pattern of pain after surgery should be improving with some occasional days of setbacks where you may have temporary increase in pain. This is normal. Sometimes you need a little bit of additional rest and care, and you should be back on track. Difficulty sleeping is also very common in the first 4 weeks due to pain and anxiety. Stay on top of your pain medication regimen if you're having trouble sleeping due to the pain. Over-the-counter melatonin before sleep can be helpful as well. A couple of tips I want you to take away from this presentation. 1. Time your opioids about an hour before physical therapy. It is very important to have your pain controlled for these visits so you can participate appropriately. 2. After physical therapy, you may experience more pain or swelling. Apply your ice machine right away and then as needed to help with this. 3. Aim to get up and walk at least once an hour while awake. This will not only help with your strengthening and endurance, but will help prevent blood clots as well. Thank you for listening. If you have any questions, please feel free to call me, Nurse Randy, at 630-339-2237. I'd be more than happy to answer any questions that you have along the way.